Welcome to the Lessons from the Leap podcast, where we showcase visionary entrepreneurs and leaders, sharing their incredible journeys and inspiring stories. Let's dive into the show.
Hello and welcome to Lessons from the Leap. I'm your host, Ghazenfer Mansoor. On this show, I get to sit down with entrepreneurs, founders, and business leaders to talk about the bold decisions, pivotal moments, and innovative ideas that shape their journey. This episode is brought to you by Technology Rivers. At Technology Rivers, we bring innovation through technology and AI to solve real-world industry problems. Most of our work is in the healthcare space, where we work with health tech leaders, build HIPAA-compliant software products. If you'd like to learn more about us, head over to technologyrivers.com and tell us more about your product. Today on Lessons from the Leap, we are joined by Eric Kolad, CEO of A Mind for All Season, a veteran healthcare operator and brain health expert. Eric is completely appending how we approach cognitive decline. Instead of passively managing the downhill slide of memory loss, he co-created the enhanced protocol to turn senior care facilities into proactive treatment centers. By combining advanced clinical testing with neuroplasticity coaching, Eric helps everyone from senior residents to elite executives optimize brain performance and halt cognitive aging. Eric, welcome to the show.
Thank you. It's great to be with you.
All right. So you've spent 16 years running assisted living facilities, watching a system build to monitor human decline. Then you took a leap, broke away, and engineered a protocol to actively reverse cognitive aging. So in a room full of healthcare executive and tech founders, how do you define yourself? Are you a care specialist who mastered brain science, or enterprise disruptor teaching the human brain as an ultimate operating system? Talk about it, and feel free to add some more context to the background that I shared.
Thank you. I think in a room full of healthcare leaders and tech entrepreneurs and people in general, the most common way that I would describe myself is actually different than any of what you put out there. People say, "Who are you?" And I say, "I'm a lifelong learner. I just love to learn. And I'm a systems thinker. I got a degree in college in interpersonal and group communication. So I was studying social sciences, and I was looking at observable patterns of behavior and how systems work. And as a systems thinker, I became very comfortable studying out those observable patterns and looking for insights and solutions. But I found that lifelong learning and just continuing to grow and to ask questions and to see what works and to try things and to see what doesn't work and then to pivot and iterate is what allows us to innovate and to solve complex challenges. So more than anything, I would describe myself as a lifelong learner as far as how I approach things in the workplace. Obviously, even more important than that is my relationship with my family members and my relationship to God and those kinds of things. But in the workplace, lifelong learner.
Thank you. Thank you for sharing that perspective. So why is our modern healthcare system so fundamentally addicted to managing symptoms rather than curing the root causes?
It's a good question, and I think there are probably a lot of different answers that would be appropriate and might shed perspective. But I think the short answer is we got addicted to our success. The average age at death in the 1900s, the early 1900s, was mid to late 40s. And that average was dragged down by just a few things. People died young more frequently because they died in childbirth, or infant mortality rates are higher, or penicillin wasn't discovered until 1927. And so without antibiotics, people were dying of acute illness and infection. If you got in a farming accident and got your arm caught in a hay baler and ripped off, that terrible injury might not kill you in and of itself, but the infection that would set in would likely kill you. And once antibiotics and antiviral agents and other wonder drugs were discovered, people started living longer. Medicine also developed different surgical techniques that allowed for repairs and replacements, and that contributed to people living longer. And many of the types of challenges that healthcare professionals solved in the 20th century were related to not full out single variable problems, but the biggest factors were single variables. And nowadays we're dealing with chronic disease that's wrecking the last few decades of life for people. And those diseases have dramatically increased. But I believe they've gone up because they're not single variable problems. So, for example, if someone gets bacterial pneumonia, there are a lot of factors that determine whether someone lives or dies, but the single biggest factor is the pathogen itself. And if you can give someone antibiotics that wipe out that bad bacteria, then the body's immune response can usually handle most of the rest, and a lot more people are going to survive that. When you're dealing with something like Alzheimer's disease or cardiovascular disease or other chronic illnesses that people are living with for decades nowadays, those are not simple single variable problems where there's a magic bullet that you can take that's going to really help improve things for you. So I think along the way, people just got addicted to the belief that there has to be a pill for every ill. And if we search long enough and hard enough, we can find it. And in the meantime, the best that we have is managing symptoms because, well, what else is there? If there's not a drug for it, then it must not be real medicine. And I think that's actually a pretty new idea. For centuries, people have done a lot of things without medication very successfully to help people. And it's interesting that now we're getting a little bit more and more back to that idea that lifestyle plays a significant role. It's only been in the last few decades that people didn't know how to eat, for example. Earlier generations of humans knew how to eat. They didn't have a problem with it. Obesity wasn't an issue. It's just been in the last few decades. So it's kind of like Dr. Benjamin Bickman, who's a physiologist and metabolic health researcher, describes it as the plagues of prosperity. So we got addicted to our own successes and we've fallen prey to the plagues of prosperity. I think that's why we have these challenges.
Cool. Yeah, thanks for sharing. And you're right. It's the addiction, we call it, or whatever. Those are the norms. We look for pill for everything. So there's a joke that if you have a diabetic, says, well, what do I eat that I can get rid of my diabetes? But if you have, it is all about still eating, not working out and other things. So that's how we look at it. We always look for pill solution. Those are easier. The rest are harder to change. So talking from obviously early 1900, you're talking about the reasons for like whether it's the childbirth and all of those reasons. Now in the last few years, other things are making a difference. The processed food, nothing is organic. Like I was hearing a podcast earlier today, it's like there's no fruit that is really natural because over the years, all those genetically modified seeds and everything, now you don't get anything natural. So what do you recommend how people change their lifestyle in this time when it is hard to get, whether it's a wheat, whether it's any of those other fruit, vegetable, all of those things, when getting a non-processed is so difficult? How do you recommend?
Well, I think of one of my friends and the title of his book. Raymond Harris wrote a book titled Control the Controllables. And I think that's good advice in a situation like this. I think it's very easy to try to be perfect and to just give up and say, well, there's no way that I can do this. It's impossible. And then you don't even try. Don't let the desire for perfection get in the way of a good effort. And I think what a good effort looks like nowadays is to control whatever it is that you can control. Can you buy produce that is at least registered as organic so that it doesn't have near as much herbicide and pesticide residue on it? Yes. And I think if you dramatically reduce the intake, maybe there's still some residues and the food isn't perfect, but your body can do a lot of the rest. especially if you're doing things to strengthen the detox pathway. If you are not overwhelming your system with things that it was never designed to do, like if you're avoiding as much high fructose corn syrup as you can, if you're cutting that out of your diet, you're improving how the liver functions. Fructose is processed exclusively in the liver. And when you eat a lot more fructose, then the liver just packs on excess fuel as fat around the liver, and you end up with a fatty liver. So if you go back to the 1970s, nobody had a fatty liver except people that were raging alcoholics. And these days, it's estimated that something like 40% of the US population of adults has a fatty liver. Well, why is that? I personally think it's because high fructose corn syrup was introduced into all sorts of foods, and people, by and large, don't read food labels. They don't realize that that ketchup that they're putting on all of their French fries is loaded with high fructose corn syrup to make it extra palatable and even a bit addictive. And when you overwhelm the liver with all of that, it can't deal with it. The human body was never meant to process that much fructose. But that's a controllable factor. You can do something about that. And when you cut out all that high fructose corn syrup and your liver is healthier, yes, you may still be exposed to different genetically modified things, or the fact that the wheat supply in this country is sprayed with glyphosate to dry it out. It's a desiccant. And I think that that's having a really negative consequence. You might not be able to avoid all of that stuff, but you're going to fare a lot better if you're strengthening the things that you can take action on. If you're physically active, if you're prioritizing your sleep, if you're engaged in stress management practices, if you're doing things to stimulate the brain properly, if you're supplementing areas where you've had some blood work and you know that you're deficient in those areas and you're doing something about it, you've just strengthened the whole system. And even though things aren't perfect, you're going to do far better than if you just weren't paying attention to those factors that are controllable.
Good advice that whatever you can, do not try to be perfect. That's great. That's perfect. So, in a lifestyle, how do you like? So, obviously, there is a physical part, there's exercise, walking, all of those, there's the eating, uh, there's a detoxification you just mentioned. So, there are different things you could do. Any recommendation on that? Or I would say, in terms of weightage, which one plays more role in people's health? Is it really food? Is it more the physical activity? Because with time that has also reduced, because now we have all these facilities. Even getting to gym, you need a car to do exercise, but we do everything by using some transport, even if we can. So based on your experiences, how much weightage do you give to each of those?
I think that's a little bit like asking what part of the car makes it go. Is it the engine, or is it the transmission, or is it the fact that the electrical system is functioning correctly? A system of systems works by virtue of the interdependence of the parts. And the body is a very complex system of systems. And it's all important. And when it comes to maintaining that system of systems, I think it becomes really difficult to parse things out. I understand why people do it, because everyone's still looking for the one thing that they can do to make a difference. It's no different than the earlier discussion that we had about why is it that people want a pill for something. People want an easy solution, and there isn't always an easy solution. So as far as the relative weight to these different things, I don't think you can say that one is more important than the other, because you can't eat your way out of a lack of exercise, and you can't exercise your way out of a really crummy diet. Both are important. And you might be eating beautifully. You might be exercising really well. But if you're only sleeping 4 hours a night, well, sleep is when the brain takes out the trash. And if you're not taking out the trash, it's going to pile up. And getting poor sleep, or let's say you've got undiagnosed sleep apnea, that's going to wreck you because that's the equivalent of a concussion every night of your life. So I think the way for people to think about it is to understand that there are two broad categories to pay attention to. There are lifestyle factors, and then there are biomarkers. Biomarkers are things that are measurable in a blood test or a urine test or something else that's quantifiable. So, for example, you can measure your vitamin D3 level. And vitamin D3 is a hormone that influences almost 1,000 genes in the body and how they express themselves. It's heavily influential on the immune system, which is why we have cold and flu season. It's really vitamin D deficiency season, in my opinion. But you can measure something like that, and you can supplement and push your D3 level to something that's optimal. On the lifestyle factors, those are things that you just have to do. And if people are aware of what the various factors are, then you can think about it kind of like potential holes in the boat that would sink your ship. So imagine that when your health is really good, it's the equivalent of the ship riding high in the water and moving along at top speed. But when your health is not good, you're sinking. The ship is taking on water, and there's never just one hole. There's roughly 100 or so different factors to be aware of. And if you can look at those factors and say, which of those are sinking my ship? Those are the things to pay attention to. So an individual might say, I'm really consistent with my exercise program. Great, that's not a hole in the boat for you. Maybe they're eating really well and they have the biomarkers to prove it. Their fasting insulin is optimal. Their A1C is optimal. Fasting glucose is really good, et cetera, et cetera. So you look at biomarkers and it confirms the lifestyle. Great, I'm eating really well. I'm doing a great job there. But I'm not sleeping. That's the thing that they should focus on. But the next person that you talk to might really need to clean up their diet. They might be sleeping great, they might be exercising really well, but diet's a big factor for them. So I think it would be a mistake to try to generalize one thing. I think we just need to look at the holes in the boat and figure out which ones we each need to pay attention to and do something about it.
How important is the detoxification?
Well, if your detox pathway is broken and things are building up in your system, it's very important. I think of a man that came to me, probably 6 years ago now, and he was in his 70s, and his family had left him. Like his wife divorced him. His adult children wouldn't talk to him because he went from happy and gregarious to just being rude. He was a jerk. His friends wouldn't interact with him anymore. And he had developed a tremor in his right hand. He couldn't hardly control it. He couldn't make a fist with his right hand. He was rude. He was accusatory. He was what you might call a really difficult person to be around. And when we dug into things for him, we found that he had some genetic issues that affected his detox pathway. And over years of time, mercury built up in his system. He had Mad Hatter's disease. Years ago in the hat making process, hat makers would go crazy. They would lose their minds because they used mercury in the hat making process. Well, here was a guy that was losing his mind, he was losing his personality, and he was developing Parkinson-like symptoms because mercury was building up because his body couldn't eliminate it as fast as he was consuming it. When he became really wealthy, he decided, I'll eat whatever I want. And most days it was ahi tuna sushi. And there was enough mercury that over a long period of time, that built up. So for him, the detox pathway was a really big deal. And I actually watched him over about 9 months get his personality back. The tremor went away. He could make a fist with his hand. His cognitive scores went up. But his mercury levels, when they were first tested, were in the 99th percentile. They had to come down dramatically, and as they did, as we strengthened that detox pathway and helped him eliminate the mercury, we saw his personality return to being warm and friendly and kind and no longer blaming everyone for every little thing that went wrong in his life.
And how much DNA play a role in that?
Well, it's been said by many people that our genetics load the gun and our lifestyle decisions pull the trigger. So this man had a genetic tendency that quite a few people have, actually. It makes it really hard to convert B vitamins into a usable form, and it can also compromise the detox pathway. He had that genetic problem, but it was his decision to eat ahi tuna sushi almost every day that really got him in trouble. Somebody else might have that same genetic tendency and hate sushi and never be exposed to that level of mercury and never develop the same kind of problem that he had. So it depends on how we're living. And more people are realizing that genetics have less and less to do with outcomes than we previously thought. It's interesting to me that the Human Microbiome Project that was done several years ago identified that there are a lot more bacteria in our system and a lot more little microbes in our system than we have genes. And it's now thought that maybe the various microbiomes in our body actually affect us even more than our own genetics. So there's a lot that's developing in all of this, a lot to think about.
Oh, cool. No, this is a good insight. So can you talk about the enhanced protocol that you created?
Yeah,
I read about it, but I want to hear a little bit more. What exactly is it and how is it making a difference?
sure. So our protocol is designed to measure the holes in the boat that we were talking about earlier and identify which ones a person is dealing with and to offer the education and support to help people know what to do to deal with those holes in the boat. So the process is really pretty straightforward. I'll describe it in 4 words: measure, learn, apply, and adjust. So we measure something related to how the human system needs to operate successfully. And we learn what the very best research has to say about that. And we help you learn about that. We provide some education and support and insight. And then we help you know how to apply what you've learned. And that comes in the form of coaching, as well as helping you know how to go talk to your doctor about things, because some things might require a prescription. And everybody needs to have a good doctor behind them, looking over their shoulder, guiding them, and helping them know what to do. And then as you apply interventions over time, you remeasure things. You redo a cognitive test, you redo some blood work, you identify what progress you've made and how your system is responding, and then you make adjustments from there. And once people have done some baseline testing and then they've done a retest, then it's kind of like we can triangulate a little bit. We can see how your body's responding and what's working and what we might be missing and help you from there. So it's basically you get a baseline cognitive test. We also do sensory testing because the senses deteriorate long before other things show up. So we test your 5 senses. And then we do an extensive panel of blood work and look at nutrients and hormones and inflammatory markers and metabolic markers and genetics. And we write a report that basically says, here are the holes in the boat that we found. Here's what the best research has to say about these things. Here are some interventions that you could consider, both lifestyle-wise, and here's some things you might supplement, or here's some things that your doctor might need to have a conversation with you about that might require a prescription. And then we help you apply it, and we provide the coaching and guidance to do that.
And how are you applying into the senior living facilities? Are you working with the facilities? Are you working with seniors directly? Can you talk more about that?
Sure. Historically, when people have come into an assisted living facility, for example, all that the facility staff has done is get the med list from the resident's doctor. They get their dietary orders, and then they figure out what activities of daily living a person needs help with. So how much assistance do they need with bathing, dressing, toileting, reminders for medication, etc. And then they put together a care plan that says, well, here's all the stuff that you need, and our job is to do those things for you. That basically accepts the fact that when someone comes into assisted living, it's because they have to. People don't wake up and hope that today is the day that they can move to an assisted living community. People move because they're declining. So imagine someone that's on a downhill trajectory. They're declining, and all that assisted living has done is to look at all the stuff that's already involved in their decline, and they just continue riding the decline down with people. And it gets harder and harder with time, and people's functional capacity falls apart over time. What we do with our protocol is to measure factors on admission and let people know, here's why you've been in decline. Here are all the things that are sinking your ship right now. And we partner with the facility. So we help get the blood work done for the resident. We help get the cognitive testing done. We write the report. We explain it to the facility and to the resident and their family. And then they coordinate with the doctor to get orders for the things that they need. And the facility helps to implement it. And then we help to track and measure the progress. And we provide training and support and Q&A sessions for facility staff along the way so that if they run into challenges, we can help them.
Well, so when managing cognitive health, obviously you're not just dealing with data points that you get from all these tests and assessment. You're also dealing with human psychology. People mindset is all about like, are they willing, or so how do you design a system that uses positive friction without overwhelming the patient's brain?
Can you give an example of what you're thinking of?
I mean, I think it's more about, like, as you talk to these patients, even showing these numbers doesn't always mean people are willing to adapt the protocol, adapt the recommendation that you're giving. So people still have to accept that. So
Yeah.
how, like, do you have a system in place? Do you, like, how do you design that where, I mean, obviously with the positive friction, that because they see all of the data, it's confusing, certain things that they feel like, but there are numbers they would say, well, this happens with the age. Like, the change hard. People many times it's all about their head, because if they already accepted that, oh, this is gonna decline, versus no, I can make that work.
Yeah. It's a great question. And I've certainly learned a lot in the last decade about how to approach those things. I think it's very easy for people to ask the wrong question in a situation like this. A lot of people would ask, how do I get this person to do what they should do for their health? I don't think that that question is as effective as asking, how could I create the conditions where this person is more likely to choose what would be helpful? And I think in order for people to really exercise agency, they not only have to have a choice, but they also have to understand the outcomes, and they have to have knowledge. So people have choices all the time, but until they have knowledge and an understanding of what outcome they're choosing, they might as well flip a coin, or they might as well be children. Children make choices all the time, but without knowledge. And it's as we get older and we have knowledge of things that then we can exercise agency. So agency, in my mind, requires knowledge. So getting back to your question, what helps people? We increase their ability to be agents who take action by providing knowledge. Many people come into a meeting with us with the idea that, well, isn't it just normal aging that these things happen? And when we can tell stories about other people who thought those same kinds of things, but chose to take action, and they got a very different outcome. And when at the same time we can explain a little bit in layman's terms why that thing worked and what we've learned about it, I find that people open to new possibilities. Not everybody does, but a significant number of people say, maybe I've been missing something all along, or wow, I never looked at it that way. I want that outcome. And once people get clear on, you could choose to eat this way, or you could choose to eat that way. But let's talk about what happens in the body with either choice. Once they get clear on what they're choosing, then I have some people that say, I know that this is killing me. I know that it's wrecking my health and making things worse. I know that my quality of life is going down, but I'm willing to accept that because I'm not willing to do things differently. A lot of people don't choose that, but some people do. And I'm okay with that as long as they're informed and they know the consequence they are choosing. What I can't accept is if people have no idea that there's another possibility, because the majority of people, when they find out that there's a better way, they want the better way and they choose it. And part of how you get there is educating, and part of it is asking questions. So,
Cool.
yeah, maybe one quick example to just round it out a little bit. When I'm talking to someone who's a type 2 diabetic, I might ask them something like, what's your understanding of how you became a type 2 diabetic? And often they say, I don't know. Isn't it genetic? And just by asking that question, they're open. They want to know. And if no one's ever explained to them what you do, what choices you make that lead to type 2 diabetes, people want to know. And then they can look back and say, oh, I see how I got here. Is there anything that I can do? And the answer is yes, there's a lot that you can do.
Oh, thanks for sharing. I have to ask this other question because it's a type of AI. So, are you using AI in any of this, and how is AI making any difference in what you are doing?
The short answer is yes, I am using AI. I'm very picky about how I use it, though, because I care about my own brain and I care about my own thinking. So, to give you an example, we do a weekly master class for our members at A Mind for All Seasons. And I do a lot of that work to do research, to go find things that we're going to talk about, to think about how I'm going to present it in a compelling way. And I start to put a presentation together. And once I've done some work, I might ask an AI tool, is there anything that I might be forgetting here? Are there any holes in my argument here? And then I might get some insight. But I generally do very little with AI to put the presentation together. And then I give it because I want it to be a human experience for people. I want people to come and learn. And I've been teaching in one way or another for 26 years. So I work hard to leverage the skills that I've developed in that time. But once the presentation is finished, I take the transcript and I might feed it to an AI tool and prompt that tool to turn that information into a fact sheet or a white paper or one sheet or something where I did all the original work, but now it's creating something that's easier for me to share with people, to add value for them. That's a common way that I would use AI.
Cool, thanks. So, if you could give our audience of high-performing founders one quick, immediate diagnostic test to see if their lifestyle is destroying their brain health, what it would be?
One diagnostic test. I would probably have them check their A1C, how much sugar is bound to a red blood cell. Most people never have their A1C checked until they become a diabetic. But elevated blood sugar is behind a lot of chronic disease. If your sugar goes up, then your insulin has to go up. And insulin is a growth hormone. So if your insulin runs chronically high, most people gain weight. And when your insulin goes up, it also has a host of other effects in the body, like you don't make as much nitric oxide. So your blood pressure tends to go up because nitric oxide opens up the blood vessels. Elevated blood sugar damages vasculature and it leads to insulin resistance, which means it's harder and harder to get glucose into the cell to turn into energy. And if those cells are in your brain, it's not going to work very well if you have significant insulin resistance. So if that one thing was managed better, people would have better health outcomes.
Cool. A1C it is. So we have been talking to Eric Kolad, who has shared such a valuable insights with us today. Eric, where can people learn more about you and your work? Is there a website, LinkedIn, email?
Yeah,
How do people connect with you?
Thank you. People can go to amindforallseasons.com, or they can connect with me, Eric D. Kolett, Collett, on LinkedIn or other social platforms. But LinkedIn is the platform that I use the most.
Cool. All right, this has been an incredible deep dive. You have given us a completely fresh lens on how to treat our brains as an ultimate operating system, driving our companies, driving our health. So it is such a valuable insight. This is something that I personally love that because this is one of the journeys that I am on, focusing on the personal health. So thank you for sharing such a valuable tips. Is there any last minute one advice that you want to give to our audience before we wrap up?
I would say never underestimate the power of taking the next right step. Most people know one or two things that they need to be doing that would improve their health outcomes. They're just not doing them. And momentum comes from being in motion. So I would invite anyone listening to think about what the one or two things that they need to be doing right now to improve their health are, and just take the next right step.
Cool. Thanks for listening to Lessons from the Leap. This episode is brought to you by Technology Rivers. At Technology Rivers, we bring innovation through technology and AI to solve real-world industry problems. We solve this by two ways. First, by helping businesses streamline and automate their operations through AI and technology. And second, by partnering with healthcare startup founders, entrepreneurs, product owners to create innovative software products from SaaS platforms to web and mobile apps. A bigger part of our work is healthcare, where we build HIPAA-compliant software products. If you would like to learn more about the work, head over to technologyrivers.com. Eric, thank you so much for being on the Lessons from the Leap.
You're welcome. My pleasure.
Thank you for tuning in to the Lessons from the Leap podcast. Don't forget to hit subscribe so you never miss an episode. We'll catch you next time.